Adult pads. Unit OK. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest. Don't touch patient. Analyzing. Don't touch patient. Analyzing. No shock advised. Start CPR. Push harder. Push harder. Good compressions. Stop CPR. Don't touch patient. Analyzing. Don't touch patient. Analyzing. Shock advised. Don't touch patient. Press flashing shock button. Shock delivered. Start CPR. Automatic defibrillator. Unit OK. Don't touch patient. Analyzing. Don't touch patient. Analyzing. Don't touch patient. Shock will be delivered in 3, 2, 1. Shock delivered. Start CPR. Unit OK. Pediatric pads. Stay calm. Check responsiveness. Call for help. Attach defib pads to patient's bare chest. Attach defib pads to patient's bare chest. Don't touch patient. Analyzing.